Okay, so right now we're going to talk about patient billing and collections. Patient financial responsibility can include copays, deductibles, coinsurances, prepayment services, unpaid balances, or even charity care. Sometimes charity care is offered to patients who qualify in both hospitals and sometimes doctors' offices. However, the key component to a charity care is paperwork and eligibility. Now, sometimes charity care will go ahead and pay for 100% of the services rendered, or sometimes just a separate percentage depending on what the patient qualifies for, depends whether much they have to, depending on what charity care pays, they still might have to pay their own portion of their financial responsibility. Cycle billing normally goes about every 30 days. Depending on where you work, your office manager or facility sometimes maybe go every 15 days or every 30 days, depending on the situation. Okay, so now we're going to talk about billing. Normally, every 30 days is a billing cycle for most doctors' offices and hospitals to where you would actually send out a patient statement for the patient to receive a bill. Now, organizing collections, possible scenarios. When you actually call a patient or a patient calls in with questions because of a bill, these are going to be possible scenarios that you have to take into consideration and be prepared for prior to the phone calls. For instance, a patient thinks the bill is too high. Patient thinks services rendered was not appropriate or effective. Patient has personal financial issues. The bill was sent to the wrong address, or there was a misunderstanding about the amount the patient's insurance was actually during paying the bill. Sometimes they feel that they don't understand what a coinsurance actually is, so they don't understand what their portion and why do they have to pay this. So a lot of times you have to explain to the patient, okay, look, this is your coinsurance, this is what your insurance did not pay, this is what you're responsible for. Sometimes a little explanation goes a long way, especially with older patients. When it comes to insurances, they really don't understand. Collection procedures. Collection procedures can be quite difficult sometimes and quite challenging. When you need to make a collection call to see about a bill, these are some main components you need to keep in mind. Only contact the patient once daily and leave no more than 3 messages per week. Do not call a patient before 8 o'clock in the morning or after 9 p.m. at night. Do not threaten the patient or use profane language. Always identify the caller, meaning identify who you are, the practice you're calling about, and the purpose for the call. However, do not discuss the patient's debt with any other person other than the patient. Make sure the patient does identify and clarify over the phone that they are that patient. Do not leave a message on the answering machine. If you do, leave it brief and do not give any information. For instance, hello, this is Karen from Dr. Smith's office. This message is for Lauren. Please give me a call back at 304-555-6000, whatever the case may be. Collection procedures continue. When you need to decide if you need to send out a collection letter or start collecting payment, this is the legal way to do this. You need to print and mail a detailed statement within 30 days. After 30 days, call the patient regarding the bill within those 45 days. Send a letter within 60 days. Send a second letter and then have a phone call within 75 days. Send a third letter within 80 days, and then finally turn over the bill to the collections agency. Now, the third letter has to be certified, and we will get into that later on in the slides. Collection letters. Letter 1 should explain in detail the reason for the letter and break down the patient's bill from insurance to patient responsibility. Include a copy of the patient's aging report and a time limit to get in contact with the office. Suggest a payment option if applicable. Sometimes doctors' offices have their own financial responsibility payment plans. So that needs to be something that you need to check into prior to sending out these letters. Letter 2 should explain in detail the severity of the delinquent bill and include a copy of the patient's aging report along with a time limit to contact the office to arrange payment options. Time limits in letters are essence because you have to give the patient a little bit of leeway to be able to get the letter, digest what the letter is, what their payments are, and then give them time to contact the office. However, sometimes patients feel that if they don't have a time limit like 10 to 15 days or 15 to 20 days, they don't take it seriously and then you may never hear from them. And then finally, letter 3 should explain in detail that this is the last time the office will be writing to collect payment and the bill will be turned over to a collections agency with a certain number of days. Once again, include a copy of the patient's aging report, which is just another bill in detailed, and send this letter certified. It's always a good idea to send this letter certified, mainly because when you get back the certified signature, you can go ahead and have documentation that you have tried to contact the patient numerous times and then you can finally send it to collections. It's always a good idea every time you contact the patient, even if you don't get any answer and you have to leave an answering machine, or if there's no answer, always document that in the patient's chart. Collection call scenarios. Always be polite, always be honest, never use profanity. Even if the patient is getting irate with you, keep your cool. Remember, you are representing your office. You do not want to use profanity or get smart with the patient. Document everything, just as I said before. Even if the patient does not answer, document everything. If the patient does get irate with you, quote what he or she says and document everything. Offer a payment plan. Depending on the office, they might have a different payment plan than usual. Know those payment plans and be able to work something out with the patient if applicable. See my example as an attached document for a collection call scenario. Now, you're going to have to do this as an assignment. That's why I gave you an attached document for an example for your assignment. If you have any other questions, email me. Skip tracing. Process of locating a patient who has an outstanding balance. This is to report them to a credit agency. When they do a skip trace search, this is the name, address, telephone number. They look for relatives and look for neighbors. Skip tracing actually helps with the collection call process because after the third letter, the office doesn't want to deal with that particular patient anymore. They have credit card agency. Skip tracing is very effective, especially for the credit agency. After this time, skip tracing and credit agencies kind of take over because many physicians' offices, after they have sent 3 letters, and the third one being certified, they have exhausted all their options in trying to collect that patient's debt. So they turn it over to a collection agency, and then they may possibly do a skip tracing and then try to find the patient. Now, sometimes in a collection agency, they will actually find the patient and try to work out a settlement. Depending on the physician and depending on how much the settlement would be or how much the collection agency is willing to settle, sometimes the patient can actually settle for a lower cost on the bill, depending on the situation. Now, it's always a good idea when you actually send a patient to collections that you document that in their patient chart. Now, sometimes depending on the physician or where you work, they do not want to see that patient anymore after they've been sent to collections. Sometimes reasons for being sent to collections could be bankruptcy or patient lost their job or they're having financial issues. It's always a good idea to try to understand where the patient's coming from and be sympathetic, but at the same time understand this is a business and you're trying to get payment for services rendered. You kind of have to use a little bit of common sense plus empathy in those situations. Now, if you have any excess questions when it comes to collections or patient accounts, when I teach this on campus, this is a hot topic for a lot of students. They have a lot of questions. You're more than welcome to email me or bring it up on the discussion board. You're more than welcome to ask me questions on there. So that wraps up patient collections. If you have any questions, like I said, please contact me.